Thank you very much. It's a pleasure for me to join you here at this meeting representing the American Society of Clinical Oncology. My name is Clifford Hudis and I'm the CEO of ASCO, an organization that is global in reach with 45,000 members, including about 15,000 outside of the United States. Among the most important efforts that we are undertaking right now is to increase our global impact and to specifically do that in the areas of quality of care and education and research. So I was really delighted to be able to speak today on several topics that relate to this effort. In one of my talks, I focus on ASCO's quality efforts and especially on how we're bringing those efforts to the rest of the world outside of the United States. We have programs where we write guidelines, they define best practices. From those, we derive measures which allow doctors and practices to assess their own performance and see how they're doing. That, of course, is meant to help them improve the quality of care that they deliver. We call that project COPI, or our Quality Oncology Practice Initiative. And I'm delighted to be able to share with you that this program has gone international, and Brazil is one of the leading countries outside of the United States participating in our COPI efforts. The very best practices that assess their performance using COPI qualify for what we call COPI certification. And I believe we're going to see first practices in Brazil reporting COPI certification in the years ahead. At the same time, one of our major goals is to improve the way we do clinical research. As everybody knows, clinical research has become much more expensive in the last few years. It has become much more cumbersome, we call that bureaucracy, and it's become very clear to many of us that a lot of what we're doing when we perform clinical research is unnecessary from the point of view of getting an efficient answer and protecting patients who participate. So for the last few years, we've been leading an effort to streamline clinical research, to strip out some of the unnecessary waste in the system, and to make it much easier for more patients and more doctors and practices to participate. So in my lecture here today, I'll be talking about exactly that effort and how in practical terms, practices here in Brazil can participate in research at a lower cost, I think with greater opportunity to contribute to global learning. So it's really a delight to join all of you at this talk, at this meeting today. It's wonderful to see all of the enthusiasm and excitement that your colleagues bring to the exciting and evolving area of oncology. And I am delighted on the part of ASCO to be able to support you, collaborate, and partner in your efforts.